started with today's episode, I would like to quickly read you our podcast disclaimer. This podcast is for educational purposes only, and it is not to substitute for professional care by a doctor or other qualified medical professional. You should always speak with your physician or other healthcare professionals before doing any fasting, changing your diet in any way, taking or adjusting any medications or supplements, or adopting any treatment plan for a health problem. The use of any other products or services purchased by you as a result of this podcast does not create a healthcare provider-patient relationship between you and any of the experts affiliated with this podcast. Any information and statements regarding dietary supplements have not been evaluated by the Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent any disease. All right, and now we'll get started with today's episode.
Hello, everyone. Welcome. Warm welcome to our podcast listeners who will be able to listen to this Q&A with Dr. Fung in a few weeks. And of course, to all our community members that get access to it right away. This is a monthly Q&A with Dr. Jason Fung, where he answers questions submitted by our TFM community members. So good morning, Dr. Fung. I hope you're having a happy holiday season.
Yes, thank you so much.
Yes. One person did send in a question about the difference between 36-hour fast and 48-hour fast. I wanted to direct them to podcast number 16 and to number 106. Remember, always the best fast is the one you can do, and consistency is key. So I'm going to start off the bat here with kind of a questionable question that's between kind of nutrition and medical. So we'll skirt the edges of medical. But this person said that she's been fasting for 6 months, and she learned on her annual screening that she has early stage iron deficiency. Her doctor ruled out all the other factors, internal bleeding, stomach acid issues. She typically eats red meat twice a week, and she is post-menopausal, so there's no blood loss. She was wondering how this could have happened. She fasts 2 days a week, so that's about a 30% decrease in her meals. She is also restricting protein more than before, and she knows that iron comes mainly from meat. Of course, it has other, dark leafy greens and things like that also have iron in them. But she said she's surprised by this, and she's begun taking an iron supplement. And I caution people what you take the iron supplement with. Be sure to take it with vitamin C as opposed to something that's going to block it. I had one client who was using almond nut butter to take it, and almond blocks the iron absorption. So her question is, should I supplement with iron while I'm fasting, or I'm going to have to do it forever? What other micronutrients should I be concerned about with fasting as a way of life?
Yeah, so really iron deficiency is a whole topic. So I can't really address that specifically because there's more to it than just fasting. Fasting, you don't take any nutrients, obviously, during the fast. So certainly if you're low in iron, then it could be worse. Certain foods, as mentioned, are higher, sort of red meats and stuff. Limiting protein, you can do it, but you don't have to do it. Like a lot of these things, you want to try to adjust your diet to what works for you. And for some people, like eating more protein works. And some people eating too much protein doesn't work. So it's, you don't necessarily have to if there are other reasons that you think you should be taking more. Really, the total iron losses in a day are not that much because you shouldn't be, iron is found mostly in blood, and you shouldn't really be losing a lot of blood on a chronic basis. There's actually not that much iron in most meals and stuff, most foods and stuff, other than meats and organ meats and liver in particular. But a lot of vegetarians and stuff do get a bit iron deficient because there's not that much iron sometimes in them. So should fasting cause iron deficiency? Probably not. We always check iron actually in our clinics because we don't want to be blamed for it. So we pick up a lot of iron deficiency before they even start. And it can certainly happen while you're doing it. So it's not really, I wouldn't really consider it a cause of. it, but certainly it can happen in conjunction with it. But you should be eating, nutrient dense foods anyway when you're eating, because you're not fasting all the time. So if you're fasting some of the time, then you should be eating more of those foods that, the micronutrients that you need. So iron isn't one of the ones that we typically see go down. Magnesium is probably one of the ones that we see go down a lot, where people get cramps. Sodium is another one. So people take these, you can take some broth and so on. But iron deficiency, it wouldn't really be a cause of it. So you just have to treat it separately. But it's not just because you're fasting. You shouldn't be the only cause of iron deficiency. Mostly you have to look for blood loss.
This next question is interesting because I know my personal results from it. So this person asks, I recently found out that I struggle with having high histamine, either from diet and or being able to process it. And I'm wondering if longer fasts, say over 24 hours, would help get rid of the high histamine and settle my body down.
Yeah, that's a good question because there's not a lot of data on fasting and histamines, but a few people have mentioned that to me as well, that they had these, they're always breaking out in hives and all these allergic reactions and stuff. And then once they started fasting, it really sort of settled it down. I'm not really sure the mechanism of why that is, and I haven't seen a lot of data as to why fasting would help. But on the other hand, I have heard a couple of cases, so there may be something to it. There's just not a lot of research in it. Fasting can help a lot of things because a lot of like histamines and autoimmune diseases and stuff are where you have sort of this overactivity of the inflammatory system. So maybe cutting down certain foods or cutting down all foods allows that inflammation to settle down. Sometimes because insulin is a nutrient sensor, it actually lowers the activity of everything in the body. And maybe that's one of the reasons that it may help. So I don't know the specifics of it, but certainly a couple of people have mentioned the same thing. And if it helps, then it doesn't even really matter why it helps. As long as it helps, then I would just go with that. The fact that it helps is the most important thing. Why it helps is secondary, right? If it helps, it helps. If it doesn't help, then it doesn't matter why it should help, right? So people always get confused because they say, well, this thing helped me. And then somebody says, well, it shouldn't. And then they stop doing it. It's like, well, why would you do that, right? Perhaps it's the placebo effect, but it doesn't matter because the placebo effect is real. If you get better, you get better. Whether it's due to a placebo effect or whether it's due to a real effect, I don't know. And it doesn't matter for the individual person. If you think it's helping you, then I would keep doing it. If you don't think it helps, then don't. But the research always lags, sometimes 10 years, 15 years. If there's no money in it, sometimes the research lags for decades.
I found your YouTube video, Fasting for Kidney Disease, Surprising Benefits. I found that very informative. I loved how you were talking about autophagy. And I actually applied that to what happened with me with histamines, which I would say I'm less reactive to histamine now, probably by 90%. I've really improved my histamine reaction, which I usually got a migraine from that. And one of the things you talk about on that is that decreasing that inflammation allows the autophagy to maybe do some healing. And that's what they're looking at with the kidneys. So why not with the mast cell reaction?
Yeah, thanks. That was the most recent video. And it was very interesting because as a nephrologist, kidney disease is what I do. And it actually showed all this benefit. So interestingly enough, it had all these benefits for diabetic kidney disease, but that's expected because the diabetes gets better. What was unexpected to me anyway, which I talked about in this video, was that the researchers, they used the fasting mimicking diet. So it's not the same thing. It's a specific protocol that they use. Now, whether that applies to all fasting, I don't know. But they showed that, in fact, for all these other diseases, IgA nephritis, membranous nephritis, all these things that are actually very difficult to treat, and even just chronic kidney disease by itself, it improved it. And this autophagy, the fibrosis. So a lot of these mechanisms that we talk about could certainly apply to mast cells and other things. So, to me, super, super interesting.
It's fascinating. The whole thing. People are getting Nobel Prizes studying autophagy. I loved that video because you went into so much that was just causing epiphanies in my little brain. So thank you. This next question is, about the fact that I can physically feel when I'm losing weight. It's hard to describe, but it's on the back of my thighs and my glutes, and I feel a mild tingling sensation. Sometimes it's very mild, sometimes it's a little more. It's like when an arm or a leg falls asleep, but much, much milder than that. It doesn't really bother me. I rather look forward to the sensation because I know I'm headed in the right direction. Is there a name for this sensation? And is it a cellular biochemical function? I like to think of it as fat cells dissolving.
Lisa, you're mentioning that you looked it up. Maybe you can fill us in a little bit on what you found.
I found that it's called lipolysis,
Lipolysis.
lipolysis, sorry,
Yeah.
and neural activity. And when the fat cells break down with this lipolysis, they release fatty acids. And this process involves blood flow and nerve signaling in the fatty tissues. And these changes can trigger mild tingling sensation. And adipose tissue changes. Fat cells start shrinking and it can affect local pressure on the nerve endings. Changes in the tissue fluid happen during fat loss, and this causes a subtle sensation in areas with more subcutaneous fat. It also has a hormonal effect. During fat breakdown, various hormones and signaling molecules are released. These can affect local nerve endings. Norepinephrine, in particular, increases during fat breakdown. While there isn't a specific medical term for this exact sensation during weight loss, it is likely related to increased local metabolism in fat tissue, changes in your circulation, and the neural response to tissue remodeling, which is very, very exciting.
Yeah, I actually think it's fascinating because I actually think it's true because I notice a little bit of that as well when I fast. Again, it's very mild. So I always just put it down to, oh, well, maybe I'm just paying more attention to it. But now that you mention it, I actually also notice similar things. Usually with a bit of a longer fast, like not the shorter ones, but with the longer ones, I definitely think that I felt it, but it's so subtle that I always think, I think it's nice, right? And I think it's in my mind. So it's actually interesting. I didn't even know that other people felt it. And it does feel like that. You start to feel it and you think, oh, it's my fat cells dissolving. So that's amazing, right? So I actually just thought it was just, I thought it was all just psychosomatic sort of.
I had the weird feeling when I was losing a lot of my weight that I could feel the smaller person inside. It's so hard to describe that feeling. It was like, I can feel this smaller person emerging out of the fat. So it's interesting. So it's definitely nerve tingling that's going on. People don't realize that the fat is innervated with nerves throughout.
Yeah.
So it's interesting.
Fascinating.
So this next question is, what are your thoughts on dry fasting?
Dry fasting is interesting. So first of all, dry fasting means that you don't drink anything. So not only are you not eating, which is fasting, but you're also not drinking anything. So no water and stuff. Because you're not drinking anything, you can become dehydrated. So it's actually quite important to make sure that you are watching yourself and you're not getting sick and so on. And it's limited because you really can't go for more than 24 hours and you really shouldn't really go for more than like 18 hours without drinking something. So it's one of these things that's really interesting because I never thought it was a great idea at first, but then people would say, well, it's actually a lot easier. And then it happened that I was doing some fasting, and again, not long stuff. It's just like I didn't eat breakfast and I didn't wind up eating lunch, but a couple of days I didn't drink anything either. And it wasn't deliberate. It was just because I got really busy. So normally I have some coffee, I have some tea and stuff. But that day I was very busy. And so I didn't drink anything. I actually thought it was actually a lot easier. It was strange. And I was still urinating, which, I just think about these things because it interests me, but I was still urinating. So what happens, of course, is that they say that when you're releasing glycogen, when you're doing the lipolysis, when your fat cells are releasing fat, they actually release some water as well, which is true because you often see this really quick drop in your weight initially with fasting, and that's water weight. So if your body has enough water, then maybe you don't need to drink, right? So the dry fasting, I always thought was doable, but not something that you needed to do. But having done it a few times, Again, mostly inadvertently. I actually did think it was a lot easier. So it all depends on the person. So again, you can't go more than a day. So if you go 12 hours, 13, 14 hours at the most, then you'd want to start to drink something. But for that period of time, if you wanted to try the dry fasting, I think it's reasonable to do, because if it's easier, then you're more likely to do it again, right? And of course, this is typical of Ramadan fasting, which is a dry fast from sun up to sundown, which is sort of 12 to 14 hours, which is right in that window where it'd be okay not to drink something. But once you get more than that, then yeah, don't push it, because you don't want to get dehydrated. It can be dangerous. And if you're on diuretics and stuff, you want to be careful. But I found it surprising that it was actually much easier.
Okay, thank you. This next question is, what is the allowable ketone level while fasting, 2 to 3 days? If you're on a strict ketogenic or carnivore diet, is it over 6 or under 7? Is that acceptable or allowable? When should you break your fast?
There's no good data on that because, ketones are supposed to rise when you fast or when you're following a ketogenic diet. But then some people, because they're measuring it, they find it really high and then they always get worried about it. The thing is that I don't know what level is too high. There's ketoacidosis, which is different. You see that with diabetes where you have too little insulin. So it used to be called starvation ketosis. So when you don't eat, when you starve or when you fast, the ketones are supposed to go up. But what level is too high? That's actually not a question that's knowable. A lot of people get worried because of the association of diabetic ketoacidosis. They say, well, maybe it's also bad for you to have too many ketones. But the point of the ketoacidosis is not the ketone so much. It's the lack of insulin that causes the acid part of it. So when they talk about starvation ketosis, it's not ketoacidosis, right? So it's a different entity completely. So I don't actually have any data. If you're not diabetic, if you're not on one of these medications that can cause ketoacidosis, then I'm not sure that there is any upper limit of ketones that is actually dangerous.
We usually say 6.9 right there. But if they're on like a SGLT, we sometimes say 4. So it's very individualized on the person.
Yeah, the SGLT2s cause ketoacidosis. So it's certainly that'd be a worry that you're developing the ketoacidosis. The question is the ketosis, how bad is it? It's a good question. The data is not there. I mean, if it's too high, some people, they go very high and then they break their fast, but then they can't lose any weight because their ketones always go high. And in which case, then you have to start saying, well, maybe you have to just monitor it and see what, how you feel and make sure that you're always doing that.
This next question is, if you have a lot of weight to lose and a lot of extra skin, how much dietary protein do you really need to eat during your meals? Don't you want your body to scavenge that extra protein? Does it make a difference to fast with water, salt, and magnesium only, as opposed to using a fasting aid such as bone broth?
Yeah, I would think so. So the skin is an interesting question because, again, there's not a lot of studies on it. We had just noticed it ourselves when we were treating a lot of people because skin is protein and so is connective tissue. So connective tissue is all the stuff that holds the cells together. It's like the scaffolding for your cells, your body, and so on. So, in the past, people would say, well, burning protein like you see with gluconeogenesis that you get in fasting, at around 24 to 30 hours or so, you get this gluconeogenesis. People used to say, oh, that's really bad. You're losing lean tissue and so on. But lean tissue is not the same as muscle. In fact, people who are overweight not only have extra fat, but they need all these sort of supporting structures for that fat, which is the skin, which is the connective tissue and the blood vessels. So that's why you see on those TV shows, where they lose a lot of weight and stuff, they actually wind up going to surgery to cut out like 20 pounds of skin sort of thing. The skin is protein. So you actually want your body can break that down. So yes, I would think that to me, I would try to do the sort of water and electrolytes only rather than the bone broth because you're really trying to get the body to break down its own protein. And then I would try to keep it in that sort of 24 to 36 hour range because remember, when you get past that, you're burning fat, which is good, but you're not burning protein. So if you can get it into that stage where you're getting a bit of that gluconeogenesis, which we know happens somewhere between 20 and 30 hours, and then just keep going to there, right? Once you're getting past that 30 hours, you're mostly breaking down fat. So it's good too. You can do it occasionally, but if skin is your major issue, try and keep into that 20 to 30 hour range as much as you can. So doing sort of like maybe 3-4 times a week rather than just doing a 3-day full fast, right? Because then at least you get that 20 to 30 hours 3 times as opposed to just once.
Thank you, Dr. Fung. How does fasting affect blood circulation generally?
Fasting doesn't directly impact it. I mean, it reduces the blood sugars and so on. So over time, if you have less diabetes, less obesity, you may have less atherosclerosis, which is the major impediment for blood flow. So blood flow is, when we think about blood flow, the main problem we have is that it doesn't get enough blood, right? And that's caused by the atherosclerosis, which is that plaque in the artery that's blocking, that causes heart attacks and strokes and gangrene and all this sort of stuff. So the major risk for that, or one of the major risks, is high blood pressure, and diabetes are two major risks. Modifiable risks, I mean, there's age and sex and genetics and stuff, but you can't do anything about those. So because the fasting and the diet play a role in hypertension and diabetes, then over time it can certainly make it better. They do these studies too sometimes where they measure blood flow to the forearm and stuff, and you see short-term changes, but it's mostly the long-term changes that we're interested in.
Fascinating. Somebody sent this in, and I have never heard this term before. It says, please explain the difference between autophagy and chaperone autophagy. When autophagy happens, the damaged essential amino acids are rebuilt as well. Is that correct?
Yeah. Autophagy is sort of 3 things: microautophagy, macroautophagy, and chaperone autophagy. It's a little bit more complex. And again, autophagy itself is a relatively new field. So I'm not sure how much applies only to chaperone autophagy versus macroautophagy. Mostly what he's talking about is macroautophagy, actually. So I don't know too much about it. I haven't seen too much about chaperone autophagy specifically. The other thing they talk about with autophagy is mitophagy, which is basically autophagy as applies to mitochondria. And the fasting is actually quite beneficial in the mitophagy, which is making sure that the mitochondria break down so that you can sort of rebuild them, right? So encouraging this metabolic flexibility where you can use either glucose or fat as a fuel. So all of those are all related because those are really important in terms, not so much of diabetes, weight gain sort of thing, but more for longevity and, overall health. But it can play a role. Sorry, I don't know that much about chaperone autophagy specifically, but for sure.
Me neither. I looked it up and I was like, okay. Like I said, Nobel Prize people are working on this stuff. So this person asks a question. Can you please explain what is happening when you take vinegar to reduce the impact of a blood sugar spike after eating? I know we want to avoid glucose spikes. Doesn't that just shove more glucose into the fat cells rather than keeping it in the circulation, where I presume it would be burned more easily?
Yeah, so vinegar is very interesting because remember, carbohydrates are chains of glucose. So if you look at bread, for example, it's composed of starches, which is composed of 2 structures called amylopectin or amylose. And they're long chains of glucose. If you take that, your body can't absorb that. It would just pass right through you if you ate it because your body can only absorb glucose as a single molecule. When you string hundreds, millions of these molecules together, it's a big long chain. So that's how they used to classify it. Complex carbohydrates had more than 2, right? A simple carbohydrate was like sugar, which was glucose and fructose. So 2 molecules versus a starch, which was considered a complex carbohydrate because it had like 2 million glucose molecules all linked together. They don't use that anymore because it doesn't really matter. What matters is how quickly you absorb that glucose. So the question is, how do you absorb that glucose? Well, You break it down and you use enzymes called amylase. So amylase is something that breaks these chains. So if you have all these chains, you have 2 million glucose molecules, use amylase to break them up, and then you break them into single or double molecules. Now your body can absorb that glucose. If you can break it down very quickly, then you absorb it quickly and you get this huge glucose spike. The problem with the huge glucose spike is that insulin also spikes along with it, and insulin drives a lot of weight gain. If you add vinegar or lemon juice or fermented foods, which are acidic foods, what happens is that you inhibit salivary amylase. So the amylase in your saliva is working at breaking down the starch as soon as you eat it. And when it goes down into stomach, still working on it, right? If you inhibit it, that is, you take the acidic food like the vinegar, then your amylase gets blocked. So it's not working nearly as well. So these long chains are not getting broken down and therefore not getting absorbed. So the rise in your glucose is much, much slower. If it eventually passes through, then you don't absorb it because it's gone through. You haven't broken it down, and the intestines can't absorb these huge, million long chain of glucose, right? You don't absorb like single, double glucose. So that's the reason that you get less of this glucose spike. Then you can measure the so-called area under the curve, which is that if you eat a food and it spikes really high, but it comes down really quick versus how much area is under the curve, you get this sort of total glucose and total insulin effect over time. So not how high it spikes up, but how much effect it has total over that period of time. And what you see is that the vinegar is actually going to reduce that by a significant amount, 30, 40, 50%. So that is if you take bread versus if you take bread with vinegar, the total effect, the total glucose that your body is seeing is going to be about 30, 40, 50% less than that. So that's good. You're not getting as much glucose. Basically, it's not getting into your body nearly the same. You're not being exposed to the same amount of insulin that you normally would. It's not the carbohydrate necessarily, it's the insulin that's driving all this effect. So if there's a way that you can sort of reduce it, you see the same thing with processed carbs versus natural carbs. So you can take oatmeal. If you compare steel cut oats, where they have the whole oat and they just cut it, versus instant oats, which is ground up really fine, it's the same calories, the same carbohydrates, in fact, the very same food. But just the way that you prepare it, steel cut versus instant, again, there's a huge difference. One has a very, very high glycemic index. One has a medium glycemic index. The total exposure of your body to the glucose is about 50% less. This is the very same food. It's not the carbohydrates necessarily. It's not even the calories. It's the way that your body breaks it down does make a real difference. And that's where the vinegar and stuff can be very useful. If you are taking carbohydrates, then yeah, it's an easy sort of thing to add or put into your diet there.
Okay. So this person has been struggling with longer fasts. She goes 50 hours. She's been doing this for about a year. All right. She does carnivore, ketovore, switches back and forth. And she's tried to do the longer fast, like a 3-day fast or a 5-day fast. Her max is 50. And then she starts having the signs and symptoms that people usually get when they first begin fasting and they're first trying to get to like a 24. And she's taking her salt, she's taking magnesium, she's even taking a little bit of potassium. And she's finding that they're not helpful at that point in time, whereas they're helpful at the beginning of the fast. And so she's just wondering, is it just that she needs to continue to build her fasting muscle? Or is there some other explanation? She's just hit her sweet spot at 50.
It could certainly be that. What I would say, though, is that it's not necessary to do a 5-day fast with just water only, because more and more of these studies that are coming out are using this sort of fasting, but not a full fast. So I'll tell you, one of the companies, L-Nutra, which does the fasting mimicking diet, which has done a lot of studies, right? To their credit, they've actually put a lot of money into research at these major universities and stuff. It's a 5-day fast every month, but it's not a full fast. They actually take some food with it. So it's very low glycemic index, sort of low protein sort of thing. They're trying not to stimulate insulin, but have you take some food. So basically, you can do the same with like vegetables. There's also a lot of data on the 5-2 diet, which is another fasting regimen, 5 days of eating normally, 2 days of fasting. But again, that's not a full fast. It's a 500 calories per day for that fast. So more and more of these studies are coming out using these sort of regimens, and they're just seeing crazy benefits, like as good benefits. So, I don't think it's necessary to, if you're going to do 5 days and you're getting problems at day 3, day 4, maybe just take a bit of vegetables or something like that, a little bit of soup that will help you. And I've done that actually, because the last 2 5-day fasts that I did, because of some of the studies, I thought, well, let me try this instead, which is fast. Instead of full fast, I'll just do it with food. And there's 2 major benefits. One is that it actually makes it easier, because from a social standpoint, it's a little awkward sometimes when you're doing a long fast and you're having dinner with your family or something, you're just sitting there. On the other hand, if I'm just sitting there, but I'm eating a little bit of vegetables, it's not a lot of calories. It's not a lot of carbohydrates. It's usually like, a bit of steamed broccoli and some soup, right? But at least I'm there. So socially, it's a lot easier. So it makes it a lot easier to do. Physiologically, I find myself not thinking about food as much because I did eat a little bit, and the benefits were almost the same. Everything seemed about the same to me. It didn't make a huge difference. So again, if it makes it easier and you're getting like 80-90% of the benefits, then hey, why not? So because the data is starting to show that, hey, it doesn't have to be a full fast, I think that it's probably, and you're having trouble, then do that. Take a little bit of vegetables. So what I do, and I don't know if this is the right thing. I mean, you could always get the fasting mimicking, where they do it every day, but I usually fast for 2 to 3 days. And then by day 3, day 4, I take a little bit of vegetables, right? And that's seemed pretty good, like, to me. And it's a good compromise between being like a strict purist and saying, well, I'm getting most of the benefits. Like it's 50% easier, but I'm getting 80% of the benefits. That's a net plus. Right? It makes it a lot easier overall. So that's something to consider, and everybody can do their own thing. But if you are having trouble, then I would say, yeah, absolutely try that. A little bit of vegetables, green vegetables, on day 3 and day 4, and see if that is enough to just push you through so that you get the continued benefits. Remember, the little bit of calories, even though you're getting the calories, you're not stimulating the insulin a lot. It's about lowering the insulin, lowering the mTOR. So that's not a lot of protein there. There's not a lot of calories there. There's not a lot of carbohydrates there, but it's something, right? There's something in your stomach. I get a lot less of this rumbling in my stomach, which is sometimes annoying at times. So yeah, try that and see how it goes, because it can really be useful.
Thank you, Dr. Fung. And I highly recommend everyone watch his latest video, which is Fasting for Kidney Disease, Surprising Benefits. He talks a lot about the different autophagy in there. So highly recommend it. Thank you so much, Dr. Fung. And I look forward to seeing you next month in the new year. Woo-hoo.
Oh, yeah, absolutely. And I do have a YouTube live as well that I do once a month. So if you join my YouTube community, you can go on there. It's a little different. I don't answer the questions so much. I try to answer a few questions, but not nearly as many as I do here. It's about a half an hour as well. Mostly I just go over sort of what's happening and what's new and all that sort of thing. But if you want, you can go on the YouTube live.
Forgot to mention, people are loving the new cohort that we started, the 12-week thing. So I know you and Megan put a lot of work into that, and people are really, really taking to it like ducks to water. So
good. I was hoping, we're trying to get something a lot more prescriptive and guiding people more through it, like pointing out specific things that they should be doing and trying to do it all together. Because remember, that's what we're here for, is we're trying to help each other. So if everybody's doing the same thing, it'll be a lot easier. We can talk about the same things, we can watch the same things. It'll give us a bit of that emotional support that most of us need to get through it. So I'm hoping that that's going to be very helpful for people. So I'm glad to hear that.
Thank you so much, Dr. Fung.
Bye.